So this is something I have spoken about before, and I did make a video about this particular spice that is very beneficial and health-giving foodstuff. But I wanted to present it in a slightly different way, and in the context of what we were speaking about today in terms of the nafs, or the ego, versus the soul, or the ruh, and try and put things into that context. Because as a doctor, one of the commonest complaints that particularly come to the desks of a family physician or a general practitioner, one of the top 5 presenting complaints is depression. Depression and anxiety, which are like 2 branches of the same tree, essentially. They're very, very similar in terms of their presentation, in terms of the symptoms it produces. Now, you know, what is depression? Depression is really defined by 3 primary characteristics. A depressed mood, where you feel low in mood for prolonged periods of time that are in the absence of any triggering event. So, for example, you could lose a loved one. And yes, of course, the normal physiological response to this or reaction to this is to feel sadness because something happened that evokes that emotion. And this is a normal response.
Yes.
In depression, it's usually something that may have been triggered by such an event, but then it goes on for a very long time and there is no other triggering event behind it. So you have the sense of kind of apathy. And then the other major component of depression that we use to identify somebody who is depressed is someone who exhibits what we call anergia, which is an absence of energy, kind of aches and pains over the body. So now we're getting more physical symptoms as a consequence of living in a particular state of mind. And the last one is anhedonia. And this is a really interesting one because anhedonia means the difficulty in finding pleasure in doing activities. For example, playing football with your friends, watching a movie with your family. You know, these are things that normally make us happy and relax. Going for a walk in the park. These are things that we take pleasure in doing. Or even our work. For example, if you're a writer, some people say that they find great joy in writing or in performing surgery or in presenting a show and so on and so forth, where you work with meaning and passion and purpose, and this goes away. So, depressed mood without an obvious trigger, feeling low in energy and aches and pains, and losing that pleasure that comes from doing something purposeful. And these things are important. And then, of course, there are biological symptoms. People who exhibit these 3, for example, will have what we call more early morning awakening. So their sleep will be disturbed. They will wake up at 2, 3 a.m. in the morning and not be able to sleep afterwards. These are some of the characteristics that we also see in those people who are defined as being depressed. And we also find, you know, changes in appetite. Some people will eat more, some people will eat less, but the appetite also gets kind of affected. And of course, when you're in this frame of mind, it's not a very pleasant place to be. People who are depressed are more prone to developing addictions, more difficulties in their relationships, their libido goes down, and so on and so forth. There's a whole list of problems. What we do is we assess a patient, we ask them a bunch of questions, and then we rate them on a score, on a rating. And from that, we can say, yep, well, this person is depressed enough. And of course, you have to also investigate the clear red flags for anybody who's depressed. You have to ask them about, and this is the very, the worst part of the assessment, where you have to point blank ask them, have you had suicidal thoughts? Are you contemplating, has it ever crossed your mind that life would be better without you alive? And so on and so forth. Have you written things down where you are contemplating this issue? And you have to really assess for their risk of suicidality, which is obviously a very difficult thing to discuss with anyone, and the patient always breaks down. And if they are indeed, if they've reached that stage, and usually they have, when they muster up enough courage to come speak to a doctor, and what they're seeking from the doctor is antidepressants, one of the most prescribed medicines out of all the different groups of medicines. And the first line medication that if the patient has a score that's high enough that we give are called the SSRIs, or selective serotonin reuptake inhibitors. The theory is that people who are depressed have a deficiency in certain neurotransmitters or chemicals in the brain. And the one believed to be foremost is serotonin, and the other one is dopamine. When these levels go down, the logic is that if you give somebody tablets, then they will be able to elevate these chemicals in their brain that is deficient. And, oftentimes we were trained to say to patients, just like if you have a thyroxine deficiency and we give you thyroxine in the form of levothyroxine, a tablet for it, it's the same kind of principle. So your body's not making enough. This is why you're depressed. And now you have to take this tablet and it will increase the level of this neurotransmitter. But we don't have any way to prove it. With thyroxine, we can measure the levels of thyroxine in your brain, in your body, in your blood system. Through taking a blood test, we can see exactly how much thyroxine you have, and if you're deficient, we can replace it, and it works amazingly. With these neurochemicals in the brain, there's no way of measuring them. There is no way of measuring them. And I think especially in the context of our spiritual discussion, we can really infer from it that living in a certain state of apathy. One of the commonest things that people will say is, they said that I just don't care. For example, I'll be driving by, there'll be a car accident on the left, it's horrific, and I'm just like, driving by, I'm like, meh. They lose this compassion, these qualities that we call the divine attributes or the names of God. And I really do believe that over time, when we start to identify with the physical aspect of ourselves more and more, we weaken the soul and we strengthen the nafs. This is an inevitability, right?
For
because
sure,
nihilism is the only way, because the body is destined and fated to die. And if you believe that that's all there is that which your physical senses perceive, then you are walking down a path towards nihilism, and that can make anyone depressed. This is one aspect of it. It's obviously a complex situation, and we shouldn't try to oversimplify it, but this is just something in keeping with those people who are not nourishing their souls sufficiently. Then there are, of course, other types of depression that come from, for example, those people who have witnessed extreme trauma, and down the line, maybe 3, 4, 5 years down the line, they develop symptoms of depression as well. But coming back to these SSRIs, I just have in front of me, I've printed out this thing, which probably is not on the slides, but it just is a list of the common or very common side effects. So when we say common in the formulary, we mean about 5% of patients are expected to have these symptoms. And when we say very common, it's about 10% of the patients. So it's a significant proportion, and sometimes it's actually even more than these numbers. So here is a list of side effects. I just wanted to read them out briefly for you. So for SSRIs, we have anxiety, appetite becomes abnormal, arrhythmias, arthralgia, which is pain in your joints, asthenia, concentration is impaired, confusion, constipation, depersonalization, diarrhea, dizziness, drowsiness, dry mouth, fever, gastrointestinal discomfort, hemorrhage, which is internal bleeding. We have headache, hyperhidrosis, which is sweating excessively, malaise, memory loss, menstrual cycle irregularities, myalgia, mydriasis, nausea, palpitations, paresthesia, QT interval prolongation, sexual dysfunction, skin reaction, sleep disorders, taste altered, tinnitus, tremor, urinary disorders, visual impairment, weight changes.
That does not sound good.
And that comes under the common or very common. And then, of course, the more uncommon ones, but let me just quickly put those out. Alopecia, angioedema, behavioral abnormal, hallucination, mania, movement disorders, photosensitivity reaction, postural hypertension, seizure, suicidal behavior, and syncope, which is basically fainting. So, a long list of side effects.
That sounds really terrible.
And when we used to do this, where we used to prescribe people antidepressants, we would go on this rating that they got, a number that they had, and we said, yep, you qualify actually for getting these antidepressant pills. But let me tell you something. I can only give you a month's worth maximum in the first go. And I have to warn you that actually for the first 1 or 2 weeks that you're taking these medicine, or perhaps up to 4 weeks, or sometimes in cases 6 weeks, your depression may worsen. It may worsen so significantly that you might even become suicidal. But don't worry, this is just a fleeting thing. It just lasts for maybe a few days, maybe for a few weeks. It's impossible to say how long. Every person is different, but it will happen. During that time, if you ever have these feelings, don't stop taking the medicines. Pick up the phone and call the crisis number, where somebody from the community mental health team will be able to assist you through this difficult period.
So
this
scary.
is the spiel that we are taught to say to patients. And eventually, after 5 to 6 weeks, the levels, because what happens is that when the levels of these neurotransmitters and these chemicals in the brain, when they're reaching an equilibrium, the mood can actually go down even further. The anxiety can be made much, much worse. And I've seen examples of people who have actually had to be admitted after a couple of weeks of being on these types of tablets. And then, of course, we find another one to replace the one that they were on. So the jury is definitely out on antidepressants, and SSRIs, the first line, are actually the safest. There are others as well that go down the line. There's tricyclic antidepressants, which have to be monitored very, very closely because they have effects on the heart and the rhythm of the heart. They can cause complications with arrhythmias and other such things. So, is there an alternative?
Is there? Hopefully there is.
That's the question, really. And I can tell you, and I'm happy to tell you, yet there is. And this is something that the Ahlul Bayt of the Prophet Muhammad sallallahu alaihi wasallam spoke about, this particular spice. It's been spoken about by the Indian Ayurvedic tradition, where it's been consumed for thousands of years. Ancient Egypt talked about it. The Greek physicians talked about it. All the ancient medical traditions identified this as a very powerful, naturally occurring spice that can help address various health problems. But what I really found fascinating was the research that has been done in terms of depression and those people who suffer from low mood for various reasons. And I wanted to now identify what the spice is. It's one of the most expensive ones that you can buy. And it is from the flower. And let's bring up our first image of that drawing of that flower with the different parts labeled. Okay, so this is the flower Crocus sativus, and it is the flower from which the spice in question, all is revealed, saffron is removed. Okay?
Amazing. Saffron.
So saffron is the spice that is being now touted to be on par with the SSRIs in terms of its effect on depression. Now, if you look at the stigma and the stamen are the central parts of it. They're part of the reproductive part of the plant. And anybody who remembers from biology, the stamen is more the male part of it, which produces pollen, and the stigma is the female part, which accepts the pollen and induces reproduction. Going to the next image, you can see how saffron is extracted from this flower. There's somebody using some pink tweezers to gently pull it away. And you can see it's a painstaking process. And this is why saffron's so expensive, because the plant's flowers are difficult and expensive to maintain. They require very specific conditions to grow in. But boy, do they produce the fruit that you're looking for, you know.
Right.
When you put in the effort, and it gives you this red gold that comes out from these flowers. And you can see the extraction going on, and that is a bunch of saffron. Saffron, a pound of it can be anywhere between, next one would show you like a bunch of saffron collected. They come in these small little packets because it is so expensive. You know, you can get it anywhere for a pound of saffron from 500 to 5,000 pounds, just depending on the quality and the work that was put forth to extract and maintain the flowers. But this is what I wanted to draw your attention to next is the study. So if we go on to the next slide, which is titled the National Library of Medicine. This is, of course, the online database where medical studies are published. It's also known as PubMed. And on it, you can see this study that I wanted to mention, which is saffron as an antidepressant. So this is, we'll put the link in the video description as well. And if you go to the one next to it, let's read a segment from this particular study. Okay, so it's highlighted there in yellow. It says, there are clinical trials conducted evaluating the efficacy, which is another way of the word effectiveness, of saffron in mild to moderate depression. The studies reported that saffron was more effective than placebo and at least equivalent to the therapeutic doses of imipramine, which is a tricyclic antidepressant, and fluoxetine, which you may also know as Prozac, one of the most commonly prescribed antidepressants. One of the top 5 most predominant diseases worldwide is depression. And then it goes on. Let's go to the next slide. And it says in it, in another study, patients were assigned to receive capsule saffron, 30 milligrams per day, 3 times a day, or a capsule of imipramine. Now, imipramine is the second line of antidepressants, so it is powerful, but it comes with more side effects. So now they're comparing it first with fluoxetine or Prozac, and now they're comparing it with imipramine, a second-line antidepressant. And it says that they were compared over a 6-week period. The result showed that saffron at this dose was found to be effective and comparable to imipramine in the treatment of mild to moderate depression.
Amazing.
Quite fascinating, isn't it? There have been cases, and I have to say, I have seen cases where I was prescribing this medication to patients and they responded really well. You know, they did have that 2-week period where they went more down, but then after that they were saying, I feel so much better on this. But doc, I have to tell you this one side effect that's making it really, really difficult. And that was the loss in libido. And obviously people who are in relationships, they're married or they want to have kids, these antidepressant tablets really do kill that aspect of your life, which is an important part of having relationships. And what they found with saffron is that not only did it elevate mood, but it did the opposite. It increased libidos and it improved the hormonal profiles of men and women. So this is something also to bear in mind. A quick caveat is that because saffron is so powerful, it can also be overconsumed, and we know that taking large amounts of saffron by mouth is unsafe. So any dose that is 5 grams or over in one go, in one day, can cause poisoning. And we also have evidence to suggest that 12 to 20 grams can cause death if you take it. It's that powerful.
My goodness.
It affects your neurochemicals, your neurophysiology. So you can imagine that, you know, you have to take it judiciously. That's why a small pinch of it is enough. And in that study, by the way, it was only 30 milligrams 3 times a day, which is about 10% of a dose that is potentially poisonous. So we're taking small amounts on a regular basis
really, isn't it?
for a period of time that is according to the individual. You may need to take it for 1 week. You may need to take it for 3 weeks. You can take it every day if you want, as long as you're taking that 30 milligrams and no more than that amount. That is the amount that has been proven to be on par in terms of its effectiveness with antidepressants of the SSRI class. So I hope this is beneficial to those people who have had such problems with depression. It's a real monster for a lot of people who wrestle with it on a daily basis. It's a very debilitating condition, but God has provided a cure for it in the form of this amazing spice called saffron. Saffron can be chewed. Unfortunately, it causes yellowing and oranging of the teeth, so that's why most people prefer to drink it as a hot tea. They can put a few strands of saffron every morning into the morning black tea. It works amazingly. Or you can put it in warm milk, which is what the Ayurvedic tradition recommends, where at night time it actually helps with sleep.
Amazing.
So
sounds very nice.
It's a real powerhouse that has over 150 active compounds, most of which we haven't even been able to study yet. So we're still discovering more.
That's incredible. And the fact that just 30 milligram would be enough to have the benefit that you're hoping to receive from it, that is incredible.
Yes, and it may not be the first day, but persevere with it for a few days and see how long it takes for your mood to change, and how it also gives you other benefits in terms of, like I mentioned, the hormonal profiles, and also with better sleep if you're drinking it with milk at night.